This is a sad statement on reproductive health, I guess. It's also a statement on the accessibility of healthcare services to regional and rural Australia. And you might expect to say, oh, well, if somebody living in rural and regional Australia is more likely to encounter negative health outcomes compared to someone living in a major city who has access to top quality healthcare, etc. That just seems to go without saying, or has been said, and I've said it a few times as well. And then you stop and think about things like miscarriage and other reproductive health outcomes, and stop to think, well, yeah, that will also affect rural and regional Australians more than those in the cities. And as a report has come to light, it's not a small difference. 60% more likely. Um, and not just access to care is a problem, you've also got access to support, perinatal support, and access to grief counselling and things like that. There's a requirement for more stoicism. It's not obviously it's not a thing that anyone wants to have to encounter, but when it happens, and is it a case of is it a procedural thing? Is it doctors not washing their hands sort of thing? Well, no, it's just harder to access the necessary health care. And well, yeah, sadly, if it's to the point that only a handful of hours is the difference between viability and miscarriage, I mean, it can be very, very sudden. It can be very, very sudden. And it's very sad when it happens. And I think um, certainly all the families I knew growing up, it wasn't never talked about. It's one of those things that tends to be suffered in silence. But I think every family I knew growing up had some experience with miscarriage, whether or not they had kids or not. That there was a an experience with miscarriage, and that's not to count all the other 3 12-week natural things where the pregnancy doesn't progress, but like mm, late term or mid term miscarriages or even stillbirth. I mean, yes, reproductive health has gotten a lot better, maternal health has gotten a lot better, but yeah, it's still something that is very pervasive. Um, and to have, oh, I mean, sadly, multiple recurrent pregnancy loss, uh, yeah, and accessing the grief services afterwards, if you're remote or regional, it's a lot harder. I don't know. I so national care standards and continuity of care models. Okay, it's only going to affect the miscarriages that could have been saved with timely medical intervention. It's not going to save the ones that were always headed for miscarriage. And culturally safe support implies that there is a cultural element to it too that is defined, that has an ethnicity element related. So, oh, and that doesn't help that midwifery centres have been shut down since 1990. Yeah, it adds risk. Three miscarriages since 2023. Oh, it's terrible for that mother. Uh, it's just, yeah, it it happens, and it sounds like they're all relatively advanced. So she knew she was pregnant. There was enough to get a fetal heartbeat. So, yeah, and it's traumatic if a if the pregnancy is no longer viable, but it takes time or a delay in getting everything fixed up. And yeah, the traumatic for the mother to carry a non-viable pregnancy for that period of time, and it can pose a risk to the mother as well, because well, there's no longer nutrients being exchanged. Um, it can become toxic and cause significant health concerns to the mother. Yeah, which is, but yeah, it's support is there is support, but it's limited, far more limited, and uh, yeah, it's. I mean, in this case here, it's well not going to change the fact the miscarriage is happening. It's just going to change how it's handled. So it's one of those sad things.